When you call 911, you want a fast response, but dispatchers are fielding a growing number of non-emergency calls, which take resources away from more urgent calls.
So the question is, what's being done about it? ABC 10's Becca Hubbecker has a closer look at a pilot project that's actually making a big difference.
911, the address of your emergency.
911, what's your emergency?
If everybody's going to the emergency room for everything, it overloads that resource.
Scott Perryman is a battalion chief for the Sacramento Metropolitan Fire District. He's also a physician assistant and oversees a pilot program that helps people who frequently call 911 with non-emergency issues. It's called Mobile Integrated Health, or MIH.
Sacramento County is one of the first in the Northern California area. What it is a nurse practitioner or physician assistant paired up with one of our paramedics.
That's because a physician assistant is allowed to do more for a patient medically than a paramedic is.
We get a chance to deal with high 911 utilizers. We also get a chance to deal with low acuity 911 issues, medication refills, simple sutures. We're able to treat and release them in the field so they don't have to go to the emergency room, wait there for hours, overloading those resources. It allows our ambulances and our engines to be ready for that next emergent call, those strokes and heart attacks, cardiac arrest.
When someone calls 911, dispatchers treat it like an emergency.
We send our fire engine and we send our ambulance. They get there, and if it's determined that it meets our scope, then they give us a call.
Metro Fire's MIH program consists of one two-person team working Monday through Friday. Firefighter paramedic Josh Katz and physician assistant Adrian Mathis.
We're not a replacement for 911. We're not a replacement for primary care.
They can treat and clear someone in the field, avoiding an ambulance trip and ER visit.
Helping people navigate our very confusing healthcare system and having more time to sit down with them, because the ER is not always the right place for that. We can do multiple visits and kind of get them connected with resources or physical therapy, something to help them live the life that they actually want to live and stay out of the hospital.
They arrive on scene in their red SUV and often find the reason this person is calling 911 so frequently is a problem they can solve.
The top 25 on our list were responsible for over 1,500 calls a year. We were able to meet and treat quite a few of them and reduce that number down. Some of those patients are calling 97 times a year. It was one that comes to mind. And when we met with her, and immediately stopped calling, and she actually hasn't called since.
They serve people in the unhoused community, people overdosing on opioids, and people with mental health issues. They also serve elderly, homebound seniors, like the couple in their 70s who left this thank you voicemail for the MIH team after Josh and Adrian taught her to operate the lift her husband uses and care for a sore on his back.
This is a great service for people that are bedbound in a lot of trouble. I'm recuperating myself from kidney cancer. My husband's got cancer, and he's got this horrible thing on his back, and they've been beyond fabulous. I can't say enough about these people. I hope you continue with this. This is the best service we've ever had.
Money for Metro Fire's MIH team runs out on November 30th. It's funded through Sacramento County Public Health, which gets annual dollars from the CDC. The county tells ABC 10 they expect another year of funding to come through. Scott says the county has been supportive of the program and is seeing positive results. In its first year, he says the MIH program saved the county and health insurance companies more than $1 million. This two-person team responded to nearly 200 calls last year and has already more than doubled that so far this year.
Sacramento is leading the way in Northern California, and we're happy to serve the community.
His long-term goal is to find a permanent source of funding. He says the majority of patients have some form of health insurance. That's why he's asking the insurance companies to jointly fund this program, saying they'll more than get that money back in the cost savings his team provides.
The cost of equipping and employing two people in this position is far more efficient of a resource use than even another ambulance would be, because that's still only one patient at a time, tied to the wall time at a hospital, tied to the employees working on that, the hiring, the training, the staffing, all of it. This is, like I said, much more agile and easily deployable.
It's the right thing to do for the patient because they're getting the care they need. It's the right thing to do for the health system because healthcare is expensive. If we can reduce that cost, oh man, it's a win.
A win for Metro Fire too, which saw a 43% decrease in frequent 911 callers after launching the MIH program.
Solving small issues that patients have, like getting prescription filled, finding transportation to and from doctor's offices, or even other stuff like food or housing or any of the other resources that we can connect them with.
I asked asked, though, could this be seen as rewarding people who are using 911 for their non-emergency needs?
Sure, it could, right? And it could very easily be looked at as we're giving special care, special treatment to our highest utilizers, like the squeaky wheel gets the grease. But in reality, those patients are going to tie up resources either way, and we can either be reactive or proactive, and that's what this program is proactive.
Not a bad idea, huh? It turns out there are MIH programs at fire departments all across the nation, including in Dallas, Memphis, and LA, and Sac Metro Fire often collaborates with those departments.